Good afternoon. We're going to get started. Hi, I'm Fran Stillman with the Institute for Global Tobacco Control, and today we have Dr. Anna Navas-Acien. When I first met, it was just Anna Navas, so that's what I'm used to saying. Anna has her degree, MD from the University of Granada in Spain, and her MPH from the National School of Health in Madrid. And she came here to do her epi degree, and that's when I met her. When she was a student, she came to work at the Institute for Global Tobacco Control. She is an environmental epidemiologist, and she has a long-term interest in health consequences of widespread environmental exposures. Her research has focused on chronic health effects of environmental exposures such as metals and air pollution, and what we know from her work with secondhand smoke. I think what I'm most impressed with is the fact that Anna is an incredible researcher and scientist, but also her research has gone on to affect policies in numerous countries around the world. So I think she has put her research into action, and she is a wonderful collaborator, and she has worked with the Institute for a very long time. She also has a secondary appointment. She's in environmental health sciences, but an appointment in EPI also. So today she's going to talk to us about her work in Turkey on secondhand smoke exposure.
Thank you. Thank you, Fran, for the introduction, and it's a real pleasure for me to be here with you and share our findings on the research that we've done in Turkey, because this is really a very dear project to myself. It's because the problem is really important, because we can see the changes, how they are happening, and that's just an enormous satisfaction as a researcher to see those changes as you move along. And of course, because we have a really wonderful team, and that makes everything much more fun and great to work on. And so the first thing I wanted to share with you is actually the team, and who are we and how are we doing this work together. So we have a set of investigators at Hopkins, including myself, Joanna Cohen from IGTC, and Jolie Susan, who is the main coordinator for the project, and then kind of the staff and the students who have really helped to put this project together, because there are lots of different pieces and you need lots of people to be able to make it work. But then we have a very important team in Turkey, and these are investigators from different universities. And without them, the project would not be possible, because it would be so difficult for us from the outside to be able to ask the right questions and to do it in the right way. We also have a very good data collection team who has been tremendously important from the beginning in terms of the planning and to the implementation of the project and the interpretation. And finally, we have an advisory committee at WHO, at the Turkish Ministry of Health, and also from the Bloomberg Initiative, because they were the funders of this project. So now I would like to tell you a little bit why is this research important and what was the motivation for doing this evaluation of secondhand smoke exposure in Turkey. First of all, as you all know, here in this room, secondhand smoke remains a very important cause of disease around the world. And in Turkey, it's really important because Turkey is one of the top 10 countries in terms of smoking burden. And so this is a position that they are not proud about, and they are highly committed to make a change. So you can see the smoking prevalence in men is 42%, and in women 13%, what is actually not low at all. If you think of smoking prevalences for women around many countries around the world, 13% is pretty high. And also the mean cigarettes per day is very high, like it's a pack per day for men and almost a pack per day for women. So that's kind of a huge problem, because if you want people to quit, we know that the number, how much people smoke, it's a big factor, and it's going to make it more difficult for them to quit. And also, if we want to implement interventions and legislations that make them not smoke in public places, that means that because they are highly addictive, it's going to be hard for them potentially to comply with the law, and also they are going to try to find places where they can actually do it. So smoking is a big issue in Turkey. But I just wanted to show this picture. I don't know if you can see very well because of the light, but this is where us, when we were planning the work, we went for dinner, and as it's very common, just a random picture, you know, a random picture taken of us. You see somebody smoking just right there. Just, you know, not need, like I was listening yesterday about these Google glasses, you are there every 30 seconds. You don't need to take 100 pictures to see somebody smoking, just one, and you get it, because it's so common. So, but as I mentioned also, they are highly committed, the country, and different from the government to the public health community, NGOs, advocates, they are highly committed to make a change. And that can be seen first with the rapid ratification of the Framework Convention for Tobacco Control. They were among the first countries to do it in December 31st, 2004. And also, they've been so far the first country in the world to implement all the 6 Empower components, including the very important component of protecting, and that's what the P stands for protecting the population from exposure to secondhand tobacco smoke. So what have they done to do that and to ensure that people are not exposed to tobacco smoke in public places is that they implemented the tobacco smoke-free law in the country. And the law was first enacted in 2008. At the time, it didn't cover all public places, but it was extended to all public places in 2009. The law was very controversial, and lots of people said there is no way that with such a high prevalence of smoking and such a high intensity of smoking, people are actually going to be able to not smoke in public places, and there was a lot of controversy. And there was also has been a lot of concerns about, is the implementation being appropriate, is it being complete? People said there is still lots of smoking in indoor areas, and there was all these big concerns about how well the implementation was going on. So several studies had been tried to evaluate the implementation of the law. In general, those studies were covering few places, especially hospitality places. Most of them were done like with convenience samples, and so there is always a lot of concerns in terms of potential bias, because which places do you select? Maybe the ones you know there is no smoking because you make it look very good compliance. Or maybe you want to select the ones where there is a lot of smoking because you want to make it look bad. So you need to do better sampling procedures to ensure that your sample is not biased and that you have adequate and valid information on what's going on. And the other types of tools that have been used are based on the surveys that are done in many of the countries, such as the Global Youth Tobacco Survey or the Global Adult Tobacco Survey. Those surveys are very useful, but at the same time, they don't provide like precise information on which are the places where the ban is not working well. So there was really need to have a better comprehensive information on the implementation of the law. So the other reason is when I described the team at the beginning, and you could see we had advisors from the Ministry of Health, we had universities from Turkey. This study was actually initiated, or the need for this study was together from the Bloomberg Initiative with the Ministry of Health in Turkey. And that's something we need to really value, is that the Ministry of Health has welcomed us from another country to do an evaluation of their law in this comprehensive manner, because they want to have like an independent evaluation. So they are helping us to work with universities in Turkey, again independent from the Ministry of Health, to evaluate the law in an independent manner. And I think it's something that really speaks a lot again about how the government in general in Turkey wants to implement this law and want to do it in a way that is correct, and want to have these external evaluations. So this is some pictures that I took that I'm bringing you here. One is from the WHO Bulletin in December 2012, talking about the law, how the law was good, what were maybe some of the problems, and we can see 2 very traditional cafes in Istanbul with 2 gentlemen eating and no smoking. There is a smoking ban. Then you see this other picture that I took from the New York Times. I don't know if you see well, I hope you see the pictures. what do you see there? You see a cafe that is really cool, very fashionable people in there, young people, and you can see the two of them, two persons smoking. This article was not about smoking in Turkey. It was just an article about Istanbul, how cool Istanbul is, how wonderful people, fashionable people are there in the city. And this was actually about a neighbor, one of the most sophisticated neighborhoods in Istanbul, where Omar Pamuk lives, and they were talking about Istanbul in general. And to me, it was just like, why does the New York Times show us a picture with people smoking? What's behind their intentions? And the New York Times has lots of pictures of cafes around the world with people smoking. So honestly, I don't know what their intentions are, but clearly they are showing in this very important newspaper that smoking remains cool and remains fashionable and widespread among young people. So that's quite interesting. This is February 2014, very recently. So supposedly in these places you should not smoke. Smoking was banned in Turkey since 2009 in all hospitality venues. So we wanted to have this kind of evaluation of how the smoking ban was working in Turkey. And we decided if we wanted to have a very comprehensive way, we needed to use some tools that were relatively easy to implement. As Fran mentioned, I am an environmental health scientist and epidemiologist, and I always like to have objective measures of the level of pollution in the environment. I always like to have biomarkers or at least environmental markers. But if we really wanted to cover the country and do it in a comprehensive way, those tools would be too expensive. It would not be practical. So we decided to take the smoke-free guide that has been developed by the Campaign for Smoke-Free Kids, Hopkins, and the Union Against Tuberculosis and Other Respiratory Diseases, and to use this guide based mostly on observations and adapt it to evaluate the Turkish law. So these were the objectives of our study. First, we wanted to use these tools from the smoke-free guide to evaluate compliance with the law in indoor public places, and we decided to use indicators for smoking. The short-term indicator would be like, do you see anybody smoking in any particular location, yes or no? And the long-term indicator would be, do you see cigarette butts on the floor or on ashtrays? And that would give you more like long-term of what's happening in that location. The other elements that we thought would be important to look at is these potential facilitators of smoking in the different locations. So we decided to measure ashtrays, to look at smoking signs, and then are cigarettes being sold, yes or no, in the particular locations. And again, because of this issue that we want to make sure that our observations are valid, we kind of did this small validation in a subset, looking at objective methods based on PM 2.5 measurements. And finally, beyond the observations, we wanted to kind of have a sense of which factors and opinions from key stakeholders in terms of implementation, what do they think of the issues are, and how maybe we can solve some of them. So we did a set of surveys with owners and employees of hospitality venues, school principals, and inspectors and other civil servants in the Ministry of Health. So I am going to describe now a little bit the methods that we used, and so this is it's a survey for our observational study. We included 12 cities in the country, one for each of the major regions that are. The European Union regions are a system that Europe has to kind of survey countries and different regions to have a comprehensive assessment of what's happening around Europe. So we use the same regions, and we use this one city, the main city for each of the region. And we used a cluster random sampling strategy, what meant that we selected 10 clusters for the large cities and 5 clusters for the small cities. And you can see in this picture, you can see the randomly selected clusters for the 3 large cities that are Istanbul, Izmir, and Ankara. And the central sampling points were selected by the National Institute for Statistics from Turkey. So again, that's great because very well respected institute in Turkey, and that gives a lot of credibility to what we are doing. And so around each randomly selected central point, we aim to observe all these different public places, including universities, schools, hospitals, government buildings, shopping malls, and hospitality venues. And we decided to select this closet of each of these type of venues around the central point. And we decided to have this kind of target number of public places: 38 universities, 113 schools, 80 hospitals, etc. No? You can read the amount. And so this was a lot of decisions in terms of why do you decide to get these numbers, to have enough sample size for each of the locations, but also acknowledge that there are more schools and hospitals than universities and this type of things. So this is a picture, and how all of these things are decided. We had a plan, we had a proposal that we had put together here in Baltimore with some discussions over the phone, but then we went to Turkey to meet and discuss with our co-investigators from the different universities and with our advisors, and Tucker is there in the middle from the WHO in Turkey. And when you are in the place, you realize that some of your ideas are not going to work and that you need to do things in better ways. For instance, the clusters, we didn't know how to select the clusters. How do we kind of narrow down the neighborhoods? How do we maybe, at the beginning we were thinking maybe we can get a roster of all the hospitals and random sample a number of hospitals, get a roster of all the schools, but then that would be very difficult to do from the fieldwork perspective. So by working together and thinking together, we had this idea of doing the central points. And then the central points will allow to get the closets of all of these type of venues around the central point. If there is only one single university in a city, it doesn't matter from which center there is, that's going to be always the closest one. So that was, if you have 2 or 3 or 10, then you select the ones that are closest to your central point. And I think this is a picture down there with all our discussions on the whiteboard. I don't know if you can see it, but here is where we decided what our central point kind of was, and kind of how we draw these ideas around the central point. Then we also discussed, going further down, which would be our meeting targets. And that's how we decided how many of the restaurants, how many of the different locations. And you can see here, we thought, let's have around 40% of restaurants, let's have around 25% of traditional coffee houses. That's something that we could not know from the outside either. How do you decide what's a traditional coffee house versus what's a modern coffee house or modern cafeteria? And that's something that the local investigators were the ones telling us, no, this is very important, we have to evaluate those separately. So, and then we have these kind of venues that we decided would be venues that are open after midnight. And that's what we would call them bars and nightclubs, venues that generally open late. So this is, again, so now you can see this kind of little drawing and thinking, brainstorming and taking decisions together. Then we adapted and added it to our protocol. And now we have our target sample sizes for the different types of locations. And again, I want to show this engaged team that we had, because these were the field workers. And the field workers were invited to our meetings and decisions. And I love this picture here because she was going to be like the person who was going to be coordinating the field workers, and she has tremendous experience doing field work. In Turkey, they are part of an institution company that's called Omega, and they are specialized in doing surveys and field work in the country. So they have a lot of experience, and they would say, that's not going to work, this is going to work. So thinking of how the study can be put in place is tremendously important as you refine your protocol. So once we took all those decisions and we finalized our protocol, we put together this venue data collection form that was going to collect the information on compliance related to the indicators that I mentioned earlier, on presence of smoking, do you smell smoke, that at the end we didn't use because it's very subjective, presence of cigarette butts, ashtrays, and the smoking signs. And we decided to do like for each venue, this is you have a hospital, we would have like a circuit that people would need to go from one location to another, starting for the entrance, looking outdoor and indoor, then taking a hallway, taking a stairwell, going to a waiting room of the hospital, going to a bathroom, going to the cafeteria, going to the garden or patios around the hospitals, and then other locations in between where you do your circuit that you may encounter and that you may want to also observe, such as, for instance, the fire escapes, were some of the places that we kind of said, let's not have them on the form, but if you see a fire escape during your circuit, just take a look at it, and others. So, and then at the end also, do you use cigarettes or not? So for each of these locations within a venue, we did our observations. Instead of doing them on paper, we decided to do them with an iPad. And so this is kind of how the form was translated into the iPad, and that was done directly in Turkish. We thought it's nowadays that everybody's around with their iPads and iPhones and etc. That was not going to kind of attract attention from people. And because we did all the field work in a clandestine way, like just walking around places without asking for permission, except in the schools, because in the schools it would be very hard to get in if you don't have special permission from the Ministry of Education. So the iPad sounds great on paper, that was a great idea, but in practice it was really painful because the data, for some reason, from each of the iPads didn't came in a consistent format. So putting together the database was a huge amount of work. It's always the case, no matter that you do your work on paper or on iPads, at the end of the day, having a good, high-quality database takes a lot of effort and time. And it's something that needs to be done very carefully. So this is our sample size, our actual sample size. I don't know if you remember, but our target number of venues was 777. So we actually did more venues than targeted, what was okay. And then among all of these venues, we saw, taking all the different locations within the venues, we had more than 4,000 venues. And you can see that in all of those venues, there are almost 40,000 people. So that's the power of observations, is that you can actually see and evaluate and observe lots and lots of different people in all of those venues. And you can, this is just the description for the different places. So for me, I always like to think, how are we going to communicate the findings to others? And how can we represent the findings in a way that is comprehensive and quick? Because as you saw in our observation forms, we collected a lot of data. So we decided to put together this kind of graphical displays. And I am showing here the two main indicators for smoking present, is there somebody smoking or not, in each of these venues, and cigarette butts present. We have them for the universities, the schools, the government buildings, the malls, the hospitals, the restaurants, cafes, the traditional coffee houses, and the bars and nightclubs. And we also distinguish the major cities and the smaller cities. As you can see very quickly, there is relatively few people smoking in most of the venues, except the hospitals, where we saw 21%, and the restaurants, especially the coffee houses, and huge lack of compliance in the bars and nightclubs. 70% of people smoking, at least one person smoking. And when we went into that, it was not just one person. It was like 10 people, 20 people were smoking in these venues. With the cigarette butts, it's very similar picture, the same pattern, the same trends, but actually even worse, with generally the bars being higher. What you can also see is that in most times, there were no big differences between the small cities and the large cities. Pretty much was very similar. So the question was, what's happening in the hospitals? How can it be that there is so much smoking going on inside the hospital? And when we run an analysis looking at the type of location within the hospital, what we notice is that most of the lack of compliance was related to dining areas within the hospital. In the rest, it was very few. Like only 1% of the rest of the non-dining areas, there was a smoker. And in cigarette butts, I mean, we saw like a 7% of cigarette butts in non-dining areas, like hallways, stairwells, that maybe it's not so good, but at least it's much better than 24% that was in the dining areas. And the same picture for government buildings. So basically, within the public places, these dining areas seem to be places where there is no compliance, and where people, they seem to think that this is not part of the public place. It's like as if the cafeteria was not part of the hospital and was behaving more like the restaurants and the cafes and the coffee houses. So the other element was the signage, and you could see that the prevalence of signage was above 60% most of the time, between 60% and 70%, but not really 100% at all. Sometimes you see low signage in places where there is little smoking, so schools. It's like the schools' principals are deciding not to invest on buying signage because there is actually no smoking in there. But in general, you see like cafes, bar and nightclubs, they should be 100% with signage. So the compliance with the signage is not high. We also look, once you have a signage, is the signage appropriate? By looking at, is it visible? You can see in the hospitals, the visibility of the signage was not very high. That means the field workers had to kind of start looking around, is it behind the corner, is it behind the curtain? And so that's something that also can be improved. And then, are they using the official signage that include the fines? And that's, here the fines are included. I don't know if somebody knows how to read Turkish. But you can see again that it's pretty high, but it's not. I mean, it's quite high. So actually, once I have a sign, it seems that it's pretty good in terms of fines. Okay, so we are very interested in understanding these facilitators, and are there things, determinants that facilitate that people smoke. And so we looked at, in addition to the type of location, and we use as a reference the non-dining public place. And then you have the dining public place, that's the cafeterias and in the restaurants, in the government buildings. You have the restaurants and cafes, we put them together, the coffee tea houses, and the bars and nightclubs. You can see huge odds ratios of 113 as compared to the non-dining areas of presence of smoking, and very similar for cigarette butts. That just tells you that this is really dramatic differences. No? Then we look at these ashtrays. You can see an odds ratio of 339, like this is again, because really, if people see an ashtray, that tells them I can smoke here. So smoking is really happening in those places where there are ashtrays, in indoor areas. And so then the cigarette sales were not really like in there unadjusted, and the non-smoking signs were not really in there unadjusted. When we adjusted for the other variables in the model, you can see that actually bars and nightclubs dramatically decrease the odds ratio. It goes from 100 to 15. 15 is still a very high odds ratio, but not as high as 100. However, the ashtrays remain very strong. So that seems to be a suggestion that really ashtrays are functioning as a mediator of the behavior. And when you account for the ashtray, the presence of ashtray, the relationship with the location type goes down, probably because there are many more ashtrays in bars and nightclubs than in non-dining public places. And for the smoking signs, what's interesting, once you adjust, the smoking signs go in a protective direction. Not significant though, but that's what you would expect, that the smoking signs are telling you don't smoke, and people are respecting the signs and they are less likely to smoke. The problem in the crude analysis is that you have the two facilitators together. You have an ashtray and a smoking sign in the same place. So what do people do? What do they go for? Okay, I can ignore the smoking sign because there is an ashtray here, and the ashtray is a much more immediate changeable kind of indicator of behavior, because the sign is fixed, but the ashtray you could potentially move it away. So I think these findings are relatively, I mean, they're kind of course, that makes total sense, no? But at the same time, they kind of indicate us that we could implement potential interventions that could be relatively simple, such as let's remove all ashtrays from these public places. We have a law that bans smoking, so there should be no ashtrays. That should just be relatively easy to implement and to provide that message. And there is some indication that the smoking signs work, and very similar findings for the cigarette butts. We also wanted to look outdoors because even though smoking is not banned in outdoor places, we want to have a sense of what's happening in these outdoor areas. And as you can see, if you remember the picture for the smoking present, it was very low in most of the public places except higher in hospitals and then in the hospitality venues. In outdoor areas, we have a very different picture. Smoking is just widespread in all the places. The same with ashtrays, although much lower. That's telling us that not so many ashtrays in outdoor areas, but lots of cigarette butts in outdoor areas. So that's telling us the cigarette butts are practically on the floor. So the issue of cigarette butts in the floor, I don't like it so much because I am an epidemiologist, but I am an environmental scientist also. So I like to think that, cigarette butts in the floor, like they travel around with the water, they travel to the ocean, they are a major problem in terms of contamination, environmental contamination. But we also looked a little bit at those facilitators of smoking in outdoor areas, and what's really interesting here is that cigarette sales in the venue are a big determinant of smoking outdoors. That didn't happen with the indoor locations, but it happens with outdoor locations. So it's this proximity of where you access tobacco that facilitates the behavior in the outdoor areas around the venue. So that's, not a surprise. People have shown this before, but it's clear in this Turkish study. And the ashtrays are important, but not in the 100s as we had in the indoor areas, because outdoor people are just smoking and even if there is not an ashtray, they feel comfortable throwing their cigarette butts on the floor. And by public place, we don't see the huge differences either, because this is just a widespread behavior in outdoor areas. So we did the validation using the PM 2.5, the fine particles that provide this kind of reliable and immediate assessment of smoking in the public place. And it's accurate in most cases, not always, because as many of you know, there are other sources of fine particles in the environment related to pollution in general. And in Turkey, actually, the levels of air pollution are pretty high, the ambient air pollution levels. So that could be a potential kind of confounder to interpret the levels of PM 2.5. So we measured PM 2.5 levels for 30 minutes, and we only did it in bars and nightclubs in a subset. So this is an example of levels that we found in some 2 venues from Istanbul. And if you use the EPA standard, that is the red line, you can see the levels are extremely high, just consistent with high levels of indoor air pollution. Again, showing that this is not just one person smoking. This is just a complete lack of compliance with the law. That remains for like the 30 minutes. And we look at the correlation between how many people were smoking in each of the place and the levels of PM 2.5, and you kind of see this trend with lower levels in places with 0 smokers, and then it goes kind of up with the rest of the people smoking. And again, you can see that lots of people smoking. So this is now kind of the end of my first set of my presentation and this is the largest part of the study, looking at compliance with the law around Turkey. And we can conclude that compliance is high in indoor non-smoking areas in public places. So this is great news for the country, because that was not like this just like 5-10 years ago. So big achievement, big improvement. So these are very good news. However, there is some like not so good news also in this evaluation, with low compliance in dining areas in hospitals and government buildings, and also in the hospitality venues, with traditional coffee houses and bars and nightclubs having the lowest compliance. the widespread smoking in outdoor areas, what also reflect, kind of make it smoking seem like something normal, something that is a part of the normal activity and really a part of the social norms, facilitating seeing smoking as something that it remains socially acceptable, and this environmental problem also. So I kind of say this possible easy intervention. I don't know how easy it would be, but we could think of eliminating ashtrays and expanding the non-smoking signs as possible interventions to improve with the implementation of the law. So we wanted to have an additional sense. Okay, we did all of these observations. We want to make sure that our observations kind of are kind of in tune with what other key stakeholders think and have their opinions. So we conducted some surveys with the hospitality venues owners and employees and the school principals, and we actually went back to the same places that we had observed. So that, again, many surveys are sometimes done in a convenient sample manner, but because we had our original sampling done in our 12 cities, we were able to go back to those venues and now contact those people, and the response rate was actually pretty high. In addition, we also interviewed 81 civil servants who were in a meeting that the Ministry of Health had organized. So these are the characteristics of the survey. You can see that the venue employees are pretty young. The owners are a little bit older. The mean is 40 years of age. The school principals are the oldest, and the civil servants are kind of intermediate, similar to the venue owners. Regarding their smoking status, you can see that the venue employees have a prevalence of 70%, very high prevalence of smoking. And the venue owners also very high. The school principals have a lowest smoking prevalence and a 30% of former smoking. So that's good news in the sense that many of them have managed to quit. And among the civil servants, kind of similar picture as for the school principals. So the knowledge in terms of the law is very high. Like practically everybody knew that there is a law in Turkey and that the law is a comprehensive law that bans smoking in all public places. So this is not a matter of not knowing what the law is about. Despite the knowledge, many owners and employees acknowledge that smoking occurs in all places, in most of the time in their venues. So they have this 15% of self-reported lack of compliance. And that's for public places. And that's actually and 50% for bars and nightclubs. If you remember our graph, we had more like 75% of bars and nightclubs where we observed smoking. So their self-reported evaluation of the law from the owners of those bars and nightclubs is substantially lower than ours. But still, they acknowledge that smoking takes place very often. And the school director says that 100% that there is no smoking, but in the indoors, but 23% acknowledge that they smoke in outdoor areas, and that 26% of the teachers smoke in outdoor areas in the school. So this is important because the children are likely to be in those outdoor areas too. So that means the teachers are exposing not just to tobacco smoke outdoors, but also to the behavior of smoking in those outdoor areas. And in this figure, we now have the opinions about the health effects of the knowledge in terms of what are the health effects of secondhand tobacco smoke. And in the dark green, we have the strongly agree that secondhand smoke can cause cancer in non-smokers, and that it's hazardous, it's dangerous for non-smokers' health. So we can see a big difference with civil servants from the Ministry of Health being the ones who strongly agree. Although you can also see a big portion, the biggest portion of disagreement among the civil servants compared to the others. So that's actually interesting. For the rest of the people that we surveyed, there was like a somewhat agreement rather than strong agreement. And we also asked people, do you think smoking should be allowed in indoor areas? And why? And in the blue, the light blue says that there should be no smoking, and the dark colors show that there should be some smoking. That smoking should be allowed. So you can see again by type of venue how it changes, with most of the people, including even the principals in the schools, indicating that smoking should be allowed in restaurants, cafes, coffee houses, and bars and nightclubs. So that's also telling us about social norms and how maybe people are not completely convinced of the benefits and the adequacy of the law. So that seems to go in parallel with the behavior and what's happening in this type of venues. We also ask about enforcement, and do they ask people who smoke in the venues to stop smoking? And if you look at according to the smoking status of the school principals, you can see that they somewhat very well. This is yes, the light blue is the very well, that they are able to enforce compliance very well. And you can see by this, the people with higher, the current smokers, their very well goes down, and they don't feel so comfortable kind of telling other people to stop smoking if they smoke, including the students or the school personnel or the parents or others. And in this figure, we have the inspector's opinions on compliance and which are the venues that are difficult to inspect. First of all, we ask which ones do you inspect, then the law compliance, and then the difficult to inspection. And what's really interesting here is that, again, all these hospitality venues are the ones that are harder to evaluate, especially the bars and nightclubs. So again, that means inspectors are less likely to do a better job if they're finding challenges to inspect those venues. And also, if you look at government buildings, they said they also have a kind of a stronger proportion of them who say that it's difficult to inspect. And actually, in addition to these questions, we have qualitative data from about what the challenges are, and many of the civil servants are telling us it's very difficult to inspect courthouses, police stations, and other places where there is authority people. And so that's telling us that a very important message, because those institutions should be taking leadership in compliance, and they should not be difficult to inspect. So this is kind of an interesting finding also. So in terms of conclusions for the interviews, knowledge of the law is high, and knowledge on the health effects is high, although most of the persons that we interviewed use the somewhat agree rather than strongly agree. But I think it's an indication that they're convinced, but not maybe totally convinced, that secondhand smoke is harmful. And the most important finding that goes with our observation findings is that the support for total smoke-free legislation is high in public places in general, but it's low for places where it's allowed to eat or to drink. And so I think that's the key finding of the study, is that compliance is low in places where you can eat and drink, no matter if those places are in a hospitality venue or in other type of public place. So the study is practically finished right now in terms of field work, and now we are just finishing all the reports and all the analysis, and dissemination is going to be a real key activity in the next few months. We need to kind of reinforce the idea on the importance of protecting workers in all public places, including hospitality venues, and we need to see how we can promote, implement interventions that could help us with facilitating the compliance with the law. So this idea of removing all the ashtrays, expanding the no-smoking signs, and also the concept of considering dining areas as an integral part of the place. For instance, we should not think that the second floor cafeteria is different from the rest of the School of Public Health. It is within the School of Public Health. So the respect for the law needs to be the same everywhere. When we disseminated these findings with the Ministry of Health, in Turkey, they told us that the they have subcontracts for these dining areas, so that the people who own those, they don't own them, but they run them, are different. And the school directors, the government building director, the hospital director, they don't think they are responsible for the implementation of the law in that location. And something that I kind of said, okay, that might be the case, but they are still within the venue. So the school director, the school hospital need to be responsible for the implementation of the law in those locations. For instance, this could be included in the agreement, in the contract that is signed between the director and the owner of the venue, of the catering, because then then if it's in the agreement and in the contract, they'll make sure that the law is implemented. So these are kind of something that I think is really important, to view those places as integral within the whole public place. There is also the need to regulate smoking in these outdoor areas that are very close to entrances, because this is, in Turkey especially, with such a high prevalence of smoking, it's a major big problem. And then finally, I think there is need in Turkey to increase knowledge on the seriousness of the health effects, because I think if you are not really convinced that secondhand smoke is harmful, it's going to be really hard to have also a good implementation that protects all people. So I want to show, highlighting again the investigators. This was our first meeting in Turkey with Mutlu Hayran, Ashley Karchoglu, and Gül Ergor, and Toker Ergoder, and Jolie and myself. And that was really a wonderful time and very productive meeting with improving the field work and what we were planning really well. And this is the field team. And then at the end, I want to show the Sertak Polak, the director in the Ministry of Health from the Tobacco Control Unit, and Toker Ergoder from WHO, because really we need to acknowledge how important they are for implementing the law, but also how generous they've been with allowing us from another country to go and evaluate their law and be so receptive in terms of the feedback that we are providing to them. Because it's not easy. It's hard for me to imagine that in the Department of Human Health here in the US, they would tell Turkey, come to evaluate our law and tell us how the law is being implemented, and we'll listen to you. And so I think, to me, that's a big lesson, no? Of being generous and be open to others from other countries and do that type of evaluation. So I am really thankful, and we know that Sertak Polak, who is the director, he allowed us to interview all the civil servants in his department, and he's waiting really eagerly to know the findings. So we need to put them together, finalize the report so that he can get them. And then we need to help them move forward. So thank you, and please, if you have questions, ask. I hope so. I hope you have questions. Good.
We want to thank Anna and take questions. Anna will repeat the question back since they're webcasting.
Thank you. Yes. Okay.
So I have a few questions, Anna. First, do you know, are there any consequences, like financial consequences for vendors if they are caught, with having people smoke inside of their restaurants?
So the question is about if there are consequences for the vendors, for the owners, no, of the venues. And so the answer is yes. So they have a fine for the customers and they have a fine for the owners. And actually, one little anecdote, in the picture that I showed at the beginning, I don't know if I can go back quickly, where we were in this bar where there is somebody smoking next to us. So Tucker, who is from the WHO, but he's very well connected with the Ministry of Health. So he got really upset because this was outside. But in this window, in the table next to us, somebody started smoking, and that was inside. And so he got really mad, and he just called the Ministry of Health directly and the chief of the inspectors. And actually, he first went inside and told the owner, you cannot do this. And the owner said, but I cannot tell the people to stop. And then he called the chief inspector and said, you need to come and find this venue. So yes, it is possible.
So then I have a follow-up with that, because you did present on principles and I guess their compliance with enforcement. So I'm curious, did you look at
so that's a great question. So the question is about the employees and how comfortable do they feel with enforcing the legislation in the venues and telling the customers not to smoke when they do it, especially because the owners might not be around. And so we asked that question, and I didn't bring it here, I should have, but actually they feel very not comfortable at all. So very few of the owners ask the smokers to stop if they see them. And also the perception, very few of the employees, and the owners too, very few. So it was very similar, so they are not really actively engaged in enforcing the law. We also asked them, are there inspections in the venue? And the employees, only 10% of them said yes, while the owners, 90% of them said yes. And these were people from the same venue. And so the question is, how can it be the perception of having inspections so different? And my feeling is that maybe the inspections are not done very thoroughly, like they maybe come at times when it's not the times where the customers are there and the employees are there, or maybe I am not sure. How can we get this very different question, very different answer for that, the same question in the same venue? Yep. Yes.
So in addition to this, regulatory ways to prevent people from smoking, are there any other actions taken by the government to disincentivize people to smoke? For example, they have levy a higher tax.
A higher what? Sorry.
Tax.
Taxes. Yes. So as I mentioned at the beginning, they've implemented all 5 elements of the Empower. And so taxes is included in Empower. Let me see, where is this? Regulations is I think raise. Yes, I was thinking raise of the taxes. So they've done that. Education. W is the quitting smoking, withdrawals, warning labels. Sorry, and which one is the quitting? The O. Okay, good. So they've done everything. So they are trying to help quitting. They have a lot of actually quitting activities. They regulate, they raise the taxes, they ban smoking. Their smoking ban is pretty good. They actually even ban e-cigarettes. You cannot use e-cigarettes in Turkey. I don't know how many countries have that, but probably very few, no? Water pipes are very common in Turkey, but they still, and they don't allow indoor water pipe smoking either, but the implementation is not very good of that part of the law. Yeah. Yes.
Hi, thanks, Anna. I have a question. I'm not sure when GATS was implemented in Turkey, if it was after this ban, but I'm wondering how your findings compare with reported measures of exposures in public places as found in GATS.
So I believe it's pretty similar from reading at the findings from GATS. Like there is, in general, I don't recall if GATS distinguishes between the type of public places. Does it? Can you remind me?
Like government places and perhaps some hospitals.
And hospitality. Yeah, so I believe the reports from the GATS were consistent in terms of lack of compliance in the hospitality, lower compliance in the hospitality venues. One issue, little thing, is with GATS, they are not able to survey nightclubs and bars very well because, this is a sample of the general population. And the distribution of people who go to these bars and nightclubs might not be really well represented in that general survey. While they are still really important from the workers' perspective. So you need those kind of more refined assessment of those venues. And that's also a very important advantage we had because of our random sampling strategy. Because we really went to true nightclubs. Like our field workers said that sometimes they were a little bit scared of going to these venues because they were truly like men only, like to the limit of what's a place that could be like I don't know, I don't even want to say the word. but it's and they did it because we had to find the closest venues to the place. That's what the type of nightclubs that were around. So that's important. Yep.
Well, maybe I'll just respond to that. Actually, GATS, which is a global adult tobacco survey, was done before and after implementation of many of the interventions. And overall, the population level, they found a decrease in smoking prevalence. So overall, the societal level, a lot of these interventions are working, but there's tweaking and improvements to do in certain types of locations. So good news, but more work to do.
I was wondering, since you did the whole country, which is really amazing, the big cities and some of the smaller cities, did you see differences by region? Because the eastern part of Turkey is very different from Istanbul, which is different from, the south.
Yes. So the question is about differences across regions in Turkey, because there are important differences between the east and the west and the south. And actually, that was a big question that we had. And a priori, we thought we would see differences, but we didn't really find big differences. And I am not sure what this means. Maybe this means that countries are more unified than what they think. Sometimes people have the feeling that there are big differences, and then actually there are not so many. Maybe because we just went to the cities. It was the biggest city in each of the regions. So even though the cities were relatively small, they might still be more in close coordination with all the cities in terms of, that's where they have universities, that's more advanced, etc. So we didn't evaluate the rural areas, so things could be different in rural settings. Yeah. Yes?
In the hospital, did you check how many medical staff smoke indoor?
So that's a great question. It's about, did we count how many of the medical staff was smoking indoors? So a question that we didn't have in our survey and that I wish we had is about, do you see people with uniforms smoking? And that we could have kind of counted, the hospital staff, the nurses, the medical staff, the civil servants that might have uniforms, but we didn't. So we cannot answer that question. We don't know of the people who are smoking. We don't know who were physicians or nurses versus the rest. In the study that now we are doing with Fran on airports, we included that question to be able to see who is smoking. Are these just customers, visitors, or are they the people who work there? So that I wish we had that answer. From anecdotally, from being in the hospitals there, we did a big tour of all the types of venues that we evaluated. Lots of physicians and nurses smoking outdoors with their uniforms. Lots of them. Yes. Yes?
Could a fear in enforcing smoking bans in restaurants and bars be because of lost business, like economic implications of doing so? And if that's the case, then how does that strengthen our argument against the tobacco industry that smoking bans don't actually affect economic?
So the question is about that one of the concerns could be the economical loss for the venues, the hospitality venues, and how does that, how can we counteract that argument for the tobacco industry? Is that the question, more or less? Yes. So I think the evidence is so strong, showing that that banning smoking doesn't hurt the hospitality venues. And when you are in Turkey and you see these venues, they are so active in so many ways. They have wonderful food, wonderful drinks, wonderful atmosphere in terms of people chatting and being together. These are great places for interaction and social interactions. So the fact that the people are smoking or not, this is just something that it's not going to change that. And we know that I remember that discussion in Baltimore, that Baltimore bars were so special because we have these cute bars where people come and enjoy themselves. They're still as cute as they were, and they're actually much cleaner now. And people are breathing better, so they are even enjoying themselves better. So I think that's an easy argument to make.
So I want to thank Anna for a great talk, and I think we've learned a great deal about Turkey. Just one statement, you can go into, I think, the New York Times, and I don't know when it was, but just a few months ago, Erdogan was in Istanbul, was walking in the streets, he looked up and he saw somebody smoking in a cafe, And he told the person, this is the president of the country, to put out the cigarette, and the person said no. And they went in with a huge fine on the person and a huge fine on the establishment. So you can look that in the newspaper. So Turkey really means business, but the work that they've done is exceptional in understanding some of these factors. So let's give her a hand and say thank you.